Hello everyone and welcome to another day of high yield USMLE questions. So today we will be talking about hematology and oncology. So we have a 10-year-old patient present to the office with lumps in the neck area. The patient first noticed the lumps while showering last week. The sizes of these lumps have not increased. Widely the patient is stable. There is no history of fever, rash, diarrhea or sore throat. Examination shows four small, non-tender, mobile and soft lymph nodes in the posterior cervical area. Which of the following is the next best step in management? So a few things you should know about the management of lymph nodes. Here they look pretty benign, so the right answer here is reassure, and let me explain. So first, which lymph nodes would require reassurance? So know this. So if the lymph node is soft, if it is mobile, if it is small, which means less than 2 centimeter, and if there is no systemic signs like fever, like weight loss, this patient does not have any fever, so or rash or any other systemic sign, and if the location is localized, if it's a localized location, which means, for example, just limited to one area, like here they are limited to cervical area, cervical lymph nodes. So in these cases, you kind of just do reassurance. So remember, localized except supraclavicular nodes. Remember, supraclavicular, especially the left supraclavicular node, which is also called the Virchow node, is associated with GI malignancy like gastric cancer. So what? Which lymph nodes would require examination? If they are associated with systemic signs like fever, rash, like weight loss, so that will require. If it is greater than 2 centimeter, it will require. If it is immobile, it will require. And if it is firm and hard, those are going to require further steps or investigation. Here they said lymph node biopsy. This is not note of, or this is node. So lymph node biopsy, that will be a wrong answer. Biopsies are usually advanced studies, so we are not going to do lymph node biopsy here without first doing the baseline investigation. If it required, like if it had these malignant kind of or worrisome kind of features, like if it was immobile, then those things. So first we would start with the baselines, and then at the end we do biopsy. So here, biopsy, wrong answer. Bone marrow biopsy, wrong answer. Complete blood count we would do if it was worrisome, like that would be the baseline, right? Just doing CBC, doing all the you're ruling out all the infections like HIV and etc. So that would be our baselines. So maybe included, but here no, because this is a pretty benign kind of feature. There is no fever, rash, diarrhea. There was just HIV. There is no fever, rash, diarrhea. There was just infectious mononucleosis. So monospot is also not the right answer. We would have done monospot, for example, if this patient had sore throat, usually with exudate. So that would be the monospot. So also the patient usually have fever as well. This patient does not have any fever. It's just the lymph nodes are enlarged, they're localized, and that's it. So remember, high yield points here would be the left supraclavicular lymph node. If they are present, usually that requires further evaluation. Otherwise, other localized lymph node enlargements, they do not require any further investigation. If there is no fever, systemic signs, doesn't require further investigations. You just reassure the patient. If it's soft, if it's mobile, if it's less than 2 centimeter, does not require any further investigations. You just reassure the patient. That's it. All right. So if anyone wants tutoring, they can email me here. This is the email. Also, you can email me here if you want to enroll in my biostats class or CCS classes. I will share details in the email. Also, you can help support the channel here. Also, I have my high yield step 2 CK notes here, which you can get for $5 USD, and it's like a 15-page document. So hope this video was helpful, and see you in the next video.